Good afternoon, everyone. On behalf, or good morning, wherever you may be, on behalf of the National Collaborating Center for Indigenous Health, I'd like to welcome everyone to this fourth and final session of the Center's virtual series, Innovative Public Health Messaging on COVID-19 and Indigenous Peoples. My name is Rick Hart. I belong to the Peter Ballantine Cree Nation in what is now known as Saskatchewan, but I come to you today from Treaty 1 territory in Winnipeg. We had originally scheduled an opening ceremony presented by Elder Clark Paul from the Eskasoni First Nation, who is currently not available. We may later in the program hear from them. Just want to do some housekeeping notes up front. All questions for panelists, as well as technical questions, audio, video, can be submitted in the Q&A window found at the bottom of your screen. Links to resources will be posted in the chat window. So you have the Q&A window and the chat window. Resources will be posted in the chat window, also found at the bottom of the screen. Today's session is being recorded and will be available later on the NCCIH website. Just know there may be some brief pauses as we move between presenters, so don't be alarmed. Let's describe the session. For those who need a refresher, this webinar focuses on the innovative development of community and distinctions-based public health messaging on COVID-19. Regional and national organizations have taken immediate and ongoing actions to develop and share credible public health information on the pandemic. They did this through the development of fact sheets, reports, infographics, and videos. The panelists will speak to these knowledge sharing formats and the lessons they've learned along the way for demystifying information and reducing stigma around COVID-19. Just to let you know, there will be 4 presentations for this session. There will be a Q&A after the first 2 and a Q&A after the last 2. There will be full bios and an online program posted in the chat. Panel number 1 is COVID-19 information sharing for First Nations communities, challenges and approaches. This will be co-presented by Regional Chief Marlene Poitras, a member of the Mikisew First Nation in Alberta. She'll be joined by Regional Chief Kevin Hart from the NCCIH First Nation in Manitoba. Welcome to you both.
Good morning, Rick. How are you today?
Doing great. Looking forward to hearing from you both.
Good morning.
So I believe, Rick, that there is a PowerPoint presentation that needs to be loaded up there. I see it on the screen. And I believe that Regional Chief Poitras is going to be taking the lead here. I want to acknowledge and welcome everybody this morning. And I'll let Regional Chief Poitras lead the way here. Good morning, Regional Chief Poitras.
Thank you, Regional Chief Hart. Tanse titom skat na kakio, nigan tawina na naskumal, anaskisika samana migoya. So I always give thanks to the Creator for this beautiful day, and thank you all for being here. My name is Marlene Poitras. I'm the Regional Chief of Alberta, and I'm here with Regional Chief Kevin Hart. And in addition to our roles at the regional, we are also the co-chairs for the AFN National COVID Task Force, and I'm also the portfolio holder for health, and my colleague Kevin is portfolio holder for emergency services. So it makes sense at this time, especially with COVID going on, that we're able to co-chair the task force. And I want to say thank you to the National Collaborating Center for Indigenous Health for the invitation to be here today. It's an honor for us to speak to you today together with all the other panelists. So the Assembly of First Nations is a political advocacy organization representing 634 First Nations in Canada, and we're directed by chiefs in Assembly. Through our work, we seek to highlight First Nations priorities, challenges, and share information and build relationships between First Nations partner organizations and government. Next slide, please. First Nations have experienced high rates of COVID-19 during the second wave of the pandemic. In the first wave, we did really well in managing to limit the spread of COVID, but the second wave was kind of, taken over a bit. And in some provinces such as Alberta, Saskatchewan, and Manitoba, our cases have and continue to make up a large portion of cases within our region, and most of our communities have seen outbreaks. As you can see, the trends that are rising in the graph that's in front of you here. So what is shown here are the First Nation cases on reserve. This does not include those cases for urban and off-reserve First Nations, which we know through data collected both in Manitoba and Alberta have followed the same increasing trend and represent a large proportion of the overall cases. The reason for this increase is complex, it's historical, and verifies health inequities, realities such as the high rates of underlying medical conditions, remote community access challenges, limited access to health services and health care resources, inadequate housing, lack of clean drinking water in many remote locations, and lower socioeconomic status make First Nations particularly vulnerable to contacting COVID-19 and experiencing severe and acute outcomes. First Nations live with interrupted access to high quality internet, inadequate funding at basic services, incomplete health data, and contend with complex jurisdictional relationships while responding to this pandemic. These enduring health inequities need to be addressed in a comprehensive manner to avoid similar hardship in the coming years. And I must add that the other trend that many of our nations are experiencing is systemic racism. So that also needs to be addressed, and that is something that we are working towards. So it's against this backdrop of complex issues that First Nations have been responding to this very complex and fast-moving virus. And as you can see now, we're dealing with a lot of the new variants, and so it is complex. And as this virus continues to mutate and evolve, we have to sometimes change course and respond to the seriousness of the issues that are at hand. So communication and information sharing is made more complex as a result of these realities, but communication is something that we have highlighted as something that's very important during this time, so that people can be informed with the adequate information that is needed, and information that is factual from the public health professionals. So next slide, please. So on the ground, the lack of human capacity and infrastructure capacity, including access to internet, and has challenged First Nations in receiving and sharing information. Challenges in accessing COVID-19 case numbers, including data for off-reserve populations in most regions, have hindered our ability to communicate effectively within our communities and our regions. Much of the information that has been shared by different levels of government throughout the pandemic has lacked a cultural and contextual lens. So, and some of the information that we do receive, especially for those that are off reserve, are often information that's not current. Indigenous Services Canada has done work to develop a communication toolkit to share vaccine information and work with partners to share culturally relevant information. However, by and large, materials being circulated are for a broader audience who are English speakers living in urban locations. So we need to keep in mind that those people that are First Nations that are living in, especially those in remote communities, English is not their first language. Historically, the federal government has failed in responding appropriately to health crises experienced by First Nations. How could we forget the body bags sent to Northern First Nations communities in Manitoba during H1N1 pandemic in 2009? The ongoing legacy of poor responses and colonial relationships mean that many First Nations distrust government policies, information, and programs. So that is a challenge that we continually have to deal with, because there's we have a long-standing issue of mistrust. So building that trust is gonna take time, and that's something again that we we continue to address and work with. The provincial and territorial jurisdiction over health is complicated by belief that First Nations are a federal responsibility. Working with that complexity challenges our ability to respond, because while we're a federal responsibility, the responsibility of health services at the provincial level is with the provinces. So there's just sometimes a lot of back and forth that we have to contend with, and which frustrates our leadership, because they just want to have the resources to deal with these challenges themselves. So the complex relationships with provincial and territorial governments and the differences in how provinces and territories have responded to the pandemic have made it more challenging for First Nations to make sense of the changing public health guidelines and recommendations. Next slide, please. The coronavirus pandemic is the first global pandemic to take place in the age of social media. Access to mass amounts of information can be overwhelming. It is accessible 24/7, and the spectrum of opinions come from every corner of the globe. So sorting out the credible information from the conspiracies can be challenging as we navigate the social media universe. Promoting current scientific and evidence-based information can be difficult. We also have pandemic fatigue. We just all want to go back to normal. We want to visit, we want to dance, we want to see our relatives who live in near and distant places. It is our culture to be together, and we all want to resume our collective lives. And it's just so important that for our culture that we gather in our ceremonies, and now in the era of COVID, it's difficult for us to do that, and we see that there's a huge rise in mental health issues that we also have to contend with. The reach of public health messaging must be relatable to First Nations audiences. Our people are dynamic, many under the age of 30. We live in cities, small towns, and many on the reserve. Communications, information campaigns, fact sheets all need to have specific and culturally relevant information that will influence behaviors and practices that will support healthier living during these uncertain times. So we have a lot of work ahead of us, and we continue to adapt to the challenges that are ahead of us, and it's something that we continue to do, and with the help of our nations in the regions, it makes it easier for us to respond to these challenges in a timely manner. So I want to say thank you for having me, and Regional Chief Kevin Hart from Manitoba will take it from here. Chief Hart. Chief Hart, you're on mute, I think.
Oh, there we are. Hear me now?
Good morning. Can you hear me now?
Oh, yeah.
All right. Good morning, everybody. Danse. I would like to welcome everybody to this series. I want to thank our hosts. I want to greet everybody from the beautiful Treaty 1 territory here in the Saugeen First Nation. My name is Kevin Hart. I'm the Regional Chief for Manitoba. I hold the portfolio of emergency services for the Assembly of First Nation. I'm one of the co-chairs of the COVID-19 task force for the Assembly of First Nations. I'll go into slide number 5. We'll start from there. And as you know, you see that First Nations have developed a communications materials and also shared information throughout the pandemic at the community level, the regional, and as well as the national level. It has clearly, you've seen it, been all hands on deck. Leadership, community leaders, regional leaders, grand chiefs, everybody through this pandemic has come together to ensure the safety of our people. We have seen that communication is needed from all levels to ensure information is being appropriately communicated. For one, it is important that these communication channels feed into one another and build off of each other's strengths as well. A diversity of approaches is needed because we've all seen this, that during this pandemic, that it's not all one size fits all. It's not one approach is best. That being said, again, we're not pandemic experts, and for us as First Nations, not only as a human being in the global spectrum of things, we're seeing that when you look at that, in many cases, regional specific public health measures, services and restrictions are best shared through regional level organizations and at the community. And if you look at the nation level, for example, for those who are familiar with the regional landscape and understand their community's needs and unique situations, we've seen that social media, the information from our frontline and the essential workers at the First Nation level have dramatically kept numbers down in regions where, because of historical government's failures in adequate housing, water, and infrastructure, that it has related to increased numbers in some of the most affected regions in this country. And we're seeing that right now when you see and look at the national stats with the regions that are being affected with some of the highest contagion right now. When you look across the board culturally and contextually, appropriate measuring has been developed and has been focused on. If you look at it, sharing information on public health measures, that's important. Our health teams and that have been doing a great job in our First Nations. Updates on COVID-19 as they become known about disease. We see it in the radio stations, you see it in the different posts, you see it in the material that's being broadcast as well as being posted in public buildings and such. There's information about funding and health supports as well too, that's very important. And something that we see right now with COVID fatigue is that mental health supports are definitely needed. Everybody is very much COVID tired, from chief and council members to our health teams to our frontline, our essential workers, to for us in Manitoba. My hands off. I lift up our grand chiefs and the members of the pandemic response coordination team and the work they've been able to do with the province of Manitoba to keep numbers down and to keep members safe. Has it been perfect? No, it hasn't, but at least we are there. We're participating in those dialogues both at the regional level and at the national level. But if you look at the community level, for example, there's a lot that's being done right now that we have to look at across the board. And if we go into the next slide, please. For example, communities have developed campaigns to support well-being as well as cultural protocols during this lockdown, such as those done. You've seen, for example, our relatives in the West Coast there, the Gwich'in, as well as you see that in Anishinaabe nations as well too. You see that firsthand how the responses, as well as in our Cree nations, where states of emergencies have been enacted to keep members safe, to lock down the communities, to keep people from outside the communities there. You see social media, for example, from one of our largest First Nations has been used to reach a wide variety of audiences. Simple campaigns, including photos of elders in communities receiving the vaccine. You've been seeing that lately. Some of those photos, such as the photos shared on the Peguis First Nation Facebook page, are community-led communication tactics that are simple and effective. And you know, I have to lift up Chief Glenn Hudson, who does sit on as my chief member on our EM Chiefs Committee at the Assembly, for the great work, having the largest First Nation in our region, as well as one of the largest First Nations in Canada, and being able to effectively keep his members safe, and also to keep numbers down in a very large First Nation. Now we look at other places, and you see sticker campaigns stating, "I got the COVID-19 vaccine," is the one shown from the Siksika First Nation. Our other tools that are being utilized and being used by our First Nations. You know, I want to hold up and acknowledge all of those who have worked so hard right now to respond to the needs of their communities. You truly are our heroes right now. Their work underpins and emphasizes the importance of supporting self-determining and funding directly at the First Nation level, because we've heard that time and time again from our chiefs from coast to coast to coast right now. You know, everyone is talking about the need for resources. And if we could go next slide, please. We look at some of the sub-regional levels, for example, some of our organizations that serve portions of First Nations in their respected regions has done tremendous jobs. Our PTOs, our tribal councils, our other organizations, for example, I've seen great work done by the Southeast Tribal Council. You see some of our most affected remote and northern communities with the Island Lake Tribal Council right now, and the great leadership that's being shown there in doing that great, excellent work in providing targeted and relevant resources and information to the nations that they serve. You've seen how they brought the plight of their nations to the national forefront on how the lack of proper resources has resulted in, you know, citizens and, you know, our most precious resources, our elders, our women, and our children being affected during this pandemic. As well, you see our political territorial organizations such as the Assembly of Manitoba Chiefs, the Anishinaabe Nation, that serve a large number of First Nations in their regions. They have done excellent work throughout the pandemic, providing targeted information in local languages and hosting webinars on topics of relevance. And they provide that up-to-date, needed information that's viewed on social media everywhere. If we look, for example, in Saskatchewan, the Northern Intertribal Health Authority has assumed a public health surveillance role in their communities. And, you know, this is great because we're able to keep communities updated on the scope of the infections, the hospitalizations, the deaths, as well as the recoveries. And as you heard from Regional Chief Poitras, COVID-19 is forever evolving. For example, the information that we heard last week is different now here today. And you hear that it's abundantly clear with the variants that we're hearing from the UK, from South Africa, and now another variant that has developed in Brazil. Well, we're getting vaccinations in our First Nations, yes. And if we can go to the next slide. However, at the same time, we are going to be entering a wave 3 of this pandemic, and we still need to properly resource, equip, and ensure the priority and the safety of people, of members, of our elders and our women, our children are at the forefront. You know, there's many examples of strong regional work. You know, we'll focus today on our regions as an addition to our role on the National COVID-19 Task Force at the National AFN Office, as you know. We have our regional work as well. And in the case with our regional colleagues across the country, we have been working with chiefs, with health leaders in our regions to support, advocated time and time again for all the much needed resources that are required by First Nations right now during the pandemic. And it's abundantly clear that the work that we've been doing with chiefs and leaders and health leaders out there in our respected regions, with the work at the national levels that we've been able to do in order to get our foot in the door, in order to make sure that we have a voice at those national tables representing First Nations, is very important and abundant. Each region, as you know, is unique. And I've heard that from regional chiefs, my colleagues, as well as chiefs from across the country when they talk about their unique structures, their protocols, and as well as the ways of them working together. This pandemic, as you know, it's emphasized the importance of relationships with our prospective provincial and territorial governments, as you know, as well as each other. But more so, we're seeing it on a national and as well as at a global level, where all of us in the human COVID-19 does not discriminate creed, race, you know, how much money you make, and et cetera, et cetera. You know, we need to protect one another and we need to be safe. And then when we talk about as in the grounds of the pandemic response, it has been led by provinces and territories that have relied on communication with us and their willingness to work with us to inform our responses and community supports. Has this been perfect? No, it hasn't. There has been concerns. We've seen that across the board when it comes to, for example, the vaccinations that are occurring. There's important, great work, though, that has been accomplished. For example, in Manitoba, a data sharing agreement and the ability to track COVID-19 cases both on and off reserve has been a key factor in our response. And that goes to the great work of people like Dr. Marsha Anderson, Marlene McKinnon, the great work of the pandemic response coordination team here in the Manitoba region. This has allowed us to effectively communicate on how the pandemic has impacted our First Nations with our people, our communities, our cities, and our regions, because we have been advocating for both on-reserve and off-reserve members. There has been advocacy for the homelessness that's occurring, as well as the homeless community that's there at a larger degree. A great deal of them are Indigenous people, and for us, you know, we always take care of one another, and that's no different here when we go out to serve and trying to protect one another, especially when we try to look after the homeless people in our community, because after all, they are our brothers and sisters. But right now, what we're seeing is that there is definitely power in the communication that's being shared in the respected regions, and that, you know, communication is very much needed at the different levels. And with that, you know, I just want to say that for us, the power of communication has been so important for everybody, from the First Nation level to the regional level. And as I stated before, our pandemic response coordination team has been Harts and you know, they need to be lifted up with the work they've done with all the PTOs in the region. They have been leading the pandemic response and providing weekly video updates, and they are available online. They also produce a wide variety of posters and fact sheets that can be utilized by communities. I know for us at the task force level, we've invited some of them. They've done presentations and they've offered that help to other regions respectfully to help during this time, because as we know, relatives, we're all in this together. We want to protect one another. So with that, I want to thank you. I want to say, Igosani, be safe, everyone. Be well. Make sure to wear a mask, hand sanitizer, and gloves when you're out in public and out there getting essentials. I mean, we have to flatten this curve. It's going to take a little bit while longer. Let's be patient, and let's remember that we're protecting our elders, we're protecting our women, and most importantly, we're protecting the little ones, our children. So thank you.
Thank you, Regional Chiefs Patra and Hart, for your presentations.
Excuse me, I think we had a couple more slides.
Yes, I believe so.
Yeah.
Okay. All right.
So you want to go to the next slide, please? Next. Yeah, there you go. Thank you very much. So I just want to talk a little bit about what we're doing in our region in Alberta. So as in Manitoba, we have a data sharing agreement with the Alberta government, which has allowed us to track COVID-19 cases for First Nations, and continues to be a key factor in our communication with our communities, with the provinces, and nationally. So it also provides us with some of the off-reserve numbers, but like I said, these are, you know, not always current and up to date when we receive those numbers, and we will be receiving the weekly update today. And our AFN Alberta regional office, we put out weekly bulletins to our leadership, our communities, to keep them update on the latest public health advice, vaccine developments, and cases. We also have an app that anybody can download for free. And we provide information there as well. And we're currently working on doing videos and radio messaging, especially to address the, you know, the threat of the variants to our communities and how we need to continue to keep safe. So we promote and work with our regional PTOs and communities to share their messages and their campaigns. This includes a Protect Our Elders campaign developed by the Alexis Nakota Sioux First Nation that shares public health messages, often using humor and comedy to talk about COVID-19 and to share information. So during this time, it's very important that we remember how to laugh and bring each other joy. Humor is an important part of our culture. First Nations are resilient. Our culture is the foundation of our strength. The resiliency remains a key piece that is important to reflect in our communications. And so some of the key messages that I provide is that our ancestors have had to deal with pandemics in the past, and you know, we're still here. They've overcome them, so we can combat this if we work together and put in measures that will you know, and steps, I guess, that our nations can do, but providing them the up-to-date information so they know that how to respond to this virus in a good way. Because, like I said previously, you know, this virtual platform that we have is a benefit to us, but it's also you know, with some of the misinformation that's on there, it can be a challenge as well. Next slide, please. So at the national level, the AFN continues to develop and share diverse material to promote vaccine uptake and communicate public health guidance. We also provide video messages, podcasts, fact sheets, and social media to share materials and information. And a lot of these are available on the AFN website. The COVID-19 vaccines have resulted in questions and concerns about the safety of the vaccines, and a lot of it because it's these vaccines were developed, only within the last year, and so there's concerns about taking those, but it's also a huge issue with trust, because of the history, for example, with the smallpox blankets, and so our First Nations are hesitant, so we try to promote and do our best to provide them factual information and to build that trust. So we work on developing information that will inform First Nations so that they can feel safe taking the vaccine and to limit the spread.
Regional Chief Patra, I just want to keep us on track here time-wise, so I know we'll definitely have more time in the Q&A to get into anything that you may not have had a chance to speak to. So thank you both, Regional Chief Patra and Hart, for your presentations. Before I introduce our next speaker and panel, I am told Elder Clark Paul from the Eskasoni First Nation is now online. So please join me in welcoming them as they provide a ceremonial welcome or beginning to all of today's participants on behalf of the center.
Well, good afternoon. Good morning with you guys, but it's afternoon here on the East Coast. And I want to thank you for sending me the invitation. And so I have to say that so far, we here in our community have been lucky. We've only had to have one person in total to isolate for 14 days since he came from Alberta to home to come to work from work. And but we haven't had any active cases. And we have a community of over 4,000 people. So in a sense, we're very lucky. But on the mainland, there have been a community that had an active case, but that active case is gone. So we're very lucky here on the East Coast. And after looking at the numbers from your area, they seem to be fairly high, and to me, they're worrisome. With the new strains of this virus coming around, it makes it easier to spread and all that. But with all that said, we all have to still depend on the Creator for our good health. Ask Him for a true cure, because we all know from our elders that for every disease that comes about, there's a cure for it within Mother Nature. And the point is finding it. If it hasn't already been destroyed by what they call progress, burning down the rainforest and all that, deforestation, which killed a lot of our medicines. But all in all, we've come a long ways. For those of you, or most of you, I should say, don't know me, but I live in a community of over 4,000 people. It's one of the biggest communities on the East Coast. And my job here at Mental Health is to work with residential school survivors and their descendants. My job is to bring back the culture that they have lost and the language. And here in Cape Breton, I have 5 communities that I serve. And there's other communities that I go to whenever they send me. So I get pretty busy. I do ceremonies here and in other communities and other provinces also. But here I concentrate on the survivors, because I know most of the survivors because I was in residential school with them. So I know what it was like there, what they went through. Hey, so I love my job, but you know, I see a lot of worries amongst the survivors, you know. But the thing is, whatever comes along, they take it in stride. They stand tall. Hey, letting you know that they've been down once and they're not going down again. Hey, and this is within our teachings, all of us, no matter what nation you're from. We were put down, and it's our turn to stand up, you know, and start helping each other. We're a people, a special people. We were here long before the Europeans got here. We were here helping each other. Anyone that was in need of food, it was supplied. Housing, that was supplied. Things that were needed in the community was supplied by the people of the community or other communities that were able to spare it. You know, so in a sense, we've lost that. And since the Europeans got here, it all went from we to me, and it has to switch back. You know, it's good that we all send our children to school, book learning. But you have to remember, there's more to learn than just from a book. You know, even as a medical doctor, you know, they have to learn each day as they see different patients. His learning didn't stop when he graduated from medical school or anything like that. His same as us. We have to learn from each other. And the biggest problem with us is that, yes, I'm well educated. And that education seems to go to one's head. And they decide to look down at others, which isn't right. You know, the person that you're looking down at, he may have something that you need. He may be able to teach you something. Never look down at a person unless you're helping them up. You know, this is a big community. I'm originally from a smaller community, which is situated right in town here in Sydney. I am from Member 2 First Nation originally. But I've been living here since I was 18 months old when my mother brought me here. Then I went to residential school. I got out of residential school, went to the States and came back. But the thing is, you know, it's your sense of belonging to a community, to a people. You know, share what we know. Always be kind. You know, I also am a co-facilitator for mental health first aid. And that in itself, lets me teach about residential school. Not only that, but it helps people recognize mental illness within our community and how it takes the whole community to help a person. You know, this coronavirus is a very scary thing. You know, even one of our boys barely comes out of his house on account of this virus. You know, every time we go somewhere, my wife takes with us that cream to clean our hands, always wearing a mask. When we first started going to town, I even used to wear gloves. You know, you go in shopping and then you take your gloves off and put them in the garbage. You know, it's scary knowing that you may have picked up something and bring it home. You know, and my bunch are always leery of that. They know we don't live forever as much as we'd like to, but the thing is, while we're here, what can we do to help our fellow man?
Elder Paul, I want to thank you for your thoughts. They've certainly grounded us, I believe, in what's important to remember as we hear the various presentations, of which there are still a number, and we also have a Q&A session. So as much as I want to spend as much as an inordinate amount of time with all folks, I know we're on a schedule, and I apologize for cutting people off. I would like to ask people in the Q&A session to please keep your responses as brief as possible. We do have 3 more panels to go and 2 Q&A sessions. So I know these things are time constrained and present challenges to that effect. But so on behalf of the center, I'd like to thank everyone who's spoken so far, and I'd like to welcome Patricia D'Souza, Director of Communications for Inuit Tapiriit Kanatami, for her presentation on COVID-19 communications, following which we'll have a Q&A session and then a cultural performance by Matt Mack. Ms. D'Souza.
Thanks so much, Rick. And thank you as well to all the panelists. As Rick said, my name is Patricia D'Souza, and I'm the Director of Communications for Inuit Tapiriit Kanatami. I've included just on the slide below our logo. It's a Facebook frame that we created sometime last year. It says Avani, which is Inuktitut. And it's a common colloquial phrase in Inuktitut that means essentially back off, or something that mothers might say to young children who are getting underfoot. And it sort of set the tone for our communications throughout the first phase of the pandemic. Next slide, please. So Inuit Tapiriit Kanatami is the national representational organization for Inuit of Canada, who primarily live in one of 4 regions in the Inuit homeland known as Inuit. The other thing that you should know about ITK is that we are a policy organization. We have direct relationships with the federal government and with the self-determining regions of Nunavut, Nunavik, Nunatsiavut, and the Inuvialuit settlement region of the Northwest Territories. And there are some other key facts there. I'm told that this slide presentation will be on the website for anyone who wants to refer to it later. Next slide, please. So our COVID-19 communications plan naturally started with advocacy because that's what we primarily do. From a communications perspective, we used a number of basic outreach tools to just draw early awareness in the pandemic planning process to the specific circumstances of Inuit communities. For those who don't know, Inuit communities are almost all served by air travel during the winter and spring, and that's how fresh food is supplied, and that's how household goods are replenished. Inuit are also dependent on southern centers for almost all advanced healthcare and laboratory services. And at the same time, Inuit experience a rate of tuberculosis that's 300 times the rate of Canadians born in the South. Things were moving really quickly this time last year, and we knew that there was a limited window to get things right. Next slide, please. So March 2020 was a period of fear and information overload for people in the South. In Inuit Nunangat, I would say people's lives didn't change overnight. Inuktitut is the majority language of Inuit Nunangat, and in some regions, 95% report using it as using it the most at home. We feared that COVID-19 was not being treated with the same seriousness across Inuit Nunangat as it was in the South early on, and wondered if one of the reasons was that the Inuktitut term that had become commonly used for the disease was also was the term that was used to describe like a mild upper respiratory infection. So we made an early decision to use that term, but also add another, and that's the we have a double-barreled word in the red bar on this slide, and the two of them together just work together to convey like a deeper, more prolonged and more serious ailment. Next slide, please. And then one of the hallmarks of the way that our national governance model works is coordinated engagement through committees and working groups, and primarily with the organizations that make up our board of directors. Those are the land claims organizations in the 4 regions of Inuit Nunangat and 3 national organizations representing youth, Inuit women, and Inuit international interests. So we worked in a collaborative way with these organizations through communications channels, public health channels, and a host of other committees arranged with these groups. Next slide, please. It was through sharing materials with our National Inuit Communications Working Group that we realized that we needed Inuit-specific materials that were available in Inuktitut. And more importantly, at the time, we knew that they had to be really quick to produce and to change as the public health advice evolved, and really quick to get out to Inuit communities. Next slide, or actually stay on this slide. So we came up with a series of social media graphics that were shared widely and adapted and adopted by a number of different organizations. So there are a couple of examples on the screen here. We added regional dialects. We shared source files with other organizations so that they could make their own posters or carpet decals. We produced new pieces every couple of days for about 6 months or so. And for the purposes of this presentation, I'm going to talk about mainly about messaging without getting deep into the other elements. So these are some of the messages that we produced. There were the caribou graphics that you've probably seen from other organizations as well. Others in this series included a skidoo and a hockey stick. Next slide, please. There were many pieces related to Inuit food sharing practices. Next slide. The one with the whales and the goose, that one was produced in response to questions from our regions about whether geese were safe to eat as they traveled north from southern communities. Next slide. These ones relate to bullying and stigma. And next slide. And these ones were centered around mental wellness. Next slide. And we did a significant series on the range of federal benefits available to Inuit. And it was during this period that we actually made a larger shift on our website. We developed an enormous chart tracking the economic support programs, and we produced it in 3 languages. And at this time, just decided that the best way to get that out there was through a website that was switchable between English and Inuktitut syllabics and Inuktitut Roman orthography, which you see in these pieces. And then the next slide. In the fall, we moved towards some reopening graphics. Next slide. And then eventually to a campaign to normalize mask wearing. We also did campaigns related to seasonal flu shot, and we're doing some vaccine competence messaging as well. And then the next slide. So lessons from this, these are pretty, I think, widely understood messages are lessons from this process. They're echoed in a federal report, a report from a federal task group on healthy living messaging, which ITK sits on. It's a subgroup of the Public Health Working Group on Remote and Isolated Communities, which is coordinated by Indigenous Services Canada. Know your audience. Language is a key part of that, but also where they live and what information tools are accessible to them. And then accessibility is the next one. You know, if you're going to require them to sign up for a program to receive benefits, is that government program actually accessible to people, or are you directing them to a website that is in English only? and then keep it simple, which is not to dumb things down, but just to break down pieces into, in the midst of information overload, to break down pieces into a way that they can be understood and acted upon. And then I'll just leave you with our social media handles to see these and other pieces. I rushed through that, but happy to take questions when we get to that point. Thanks very much.
Thank you, Patricia D'Souza. I will start my video. There we go. And so just to let everyone know ahead of time, we're going to allocate about 10 minutes so we stay on track as much as possible with regard to time. And so we'll stick with Patricia D'Souza for this first question, which had to do with whether or not there were, among the populations you serve, among ITK, the people you serve, communities you serve, whether there's been a reluctance to wear masks or not. And if so, how was that dealt with?
So that is actually the primary reason that we started our social media mask campaign, because in the South, we noticed, normalizing masks happened just by leaving your house. If to go to the grocery store, you saw other people wearing masks. You saw people at the door to those stores not letting you in or providing masks if you didn't come there wearing one. And in Inuit communities, it wasn't so much the case, and certainly not right away. Particularly because there weren't a lot of cases in our communities in the first wave, and that changed in the second wave, and things got very serious very quickly. So we just wanted to get photos out there of Inuit wearing masks and talking about why it was important, with the hope that it would come to be seen as a common practice, and that is starting to happen. And hearing anecdotally from communities that when they see people in grocery stores or in other indoor buildings not wearing masks, or gathered in larger groups not wearing masks, and that's cause for concern. And that's just a good thing for all of us to be aware of, especially in our remote communities.
Regional Chiefs Poitras and Hart, your response to this?
Yeah, I can. I guess it helps that the provinces put the restrictions in place for mandatory masks. That did help a lot. And but when you go out to some of the communities, you can see that there's less likelihood to wear masks initially, but now it's acceptable, and people are starting to wear masks everywhere you go, and it's just a matter of communicating, and that's why we're going to do our video and our radio messages to encourage people to wear masks and to continue to practice the public health safety protocols.
Chief Hart, anything to contribute there, or? Oh, you're muted.
There we go. Thank you for that, Rick. Yes, absolutely right. Now, you've seen that on the global scale as well as nationally in First Nations at the beginning of the pandemic. There was a lot of people, especially our young people, that thought they were invulnerable. You can go out there. This virus will not affect you. It won't affect our nations. And then slowly, people start getting sick. And now we're seeing the results of that. Of course, you see respectfully here in the Manitoba region, you see in Saskatchewan, Alberta, some of the most chronically underfunded regions in this country when it comes to housing, water, and infrastructure needs. And it's very apparent right now during this pandemic that this has resulted in infections and the high rates of infections that we're seeing in these respective regions. What does that mean? Well, it's going to mean investments from the federal government in housing, in clean drinking water, in proper infrastructure to be in place for that. We see that at great length. You've seen with the public health orders and how, you know, other provinces lag behind, for example, when one province would enact a state of emergency and start closing their borders down, start having travel restrictions in place. Some of the other have as high numbers or weren't using those public health guidelines right away. You could see how infections occurred in other regions across this country. I mean, the science is there. You could see the science in what has happened because of a result of travel restrictions, a lack of housing, water, infrastructure in our communities and such right now, and the result from First Nations and governments that you know, we've been at the back burner for a long, long time, Rick. And for people out there, the stats are there. We have an Auditor General's report that indicates that the emergency measures and the resources to First Nations are next to nil from the federal government in terms of investments. When this pandemic first hit, it took us as the Assembly over a couple of months just to get a pandemic plan from the federal government. So it shows that even the federal government wasn't prepared for this. So First Nations and leaders had to become experts as we went along, learning from our own people as well as our own experts that we have.
Okay, we have about 3 minutes left, so I'm going to stay with you, Chief Hart. Give about a minute each, which is always longer and shorter than we think, so be as succinct as possible. A question from Valerie: is there anything positive that's come out of the pandemic that you'd like to see stay post-pandemic? It could be in terms of the relationships with partners, etc., however you wish to determine. And I'm starting the clock. Go ahead, Chief Hart.
Well, I think what we've seen right now is that there's unity more than ever amongst First Nations and amongst us as human beings. I mean, it's been all hands on deck. You know, all the heroes out there are the doctors, the nurses, our health teams, our chief and council members, you know, our grand chiefs, those people that are manning the checkpoints in our First Nations, right? Those that are at the arenas making food hampers that are being delivered to hundreds of households in each and every First Nation. I'm thinking of the deliveries of PPE and such, and you know, at the beginning of this pandemic, that was something that was lacking in First Nations that needs to be addressed. We need to, even now with the upcoming third wave, we have to ensure that we have the proper PPE and the infrastructure in place to take care of our people.
Okay.
That means masks, hand sanitizer, and gloves, Rick.
Okay, thank you, thank you. All right, let's go to Chief Poitras. 1 minute. Sorry to hem you in there. I think you're muted.
Yeah,
That's okay. So positive legacies.
Yeah, I think in terms of, there's certainly a heightened awareness of First Nations issues, and, you know, but there's also awareness of the good practices that our leadership had taken, and, you know, with the additional resources that were provided. And I think that's a really good start as First Nations talk about sovereignty and nationhood, you know, and that it demonstrates that they can do the work and that they're very good at it. And you know, I think that the government needs to continue to work with the First Nations, provide the necessary resources, and get out of the way so we can go ahead and get the work done. Thank you.
Thank you. All right. Patricia D'Souza, your response to that question on behalf of ITK.
I'd say two things, very similar to the earlier answers, that you know, there's been a number of opportunities to talk about the existing vulnerabilities of Inuit communities and how they are, you know, amplified during the pandemic. but also to demonstrate how Inuit land claims organizations and Inuit regions and Inuit communities themselves are able to deliver on needs when those vulnerabilities are recognized and accounted for in response plans.
All right, thanks to all three of you. Sorry to push you there towards the end, but I very much appreciate your time on behalf of the center. So it is now time for our cultural performance. I'd like to ask everyone to please join me in welcoming Matt Mack, aka Matthew Munias, an Ojibwe music producer and recording artist from Garden Hill First Nation in Manitoba. Matt Mack, take it away.
Hello?
Hello.
All right. Is this working?
Yeah,
It's working?
it's working great.
Okay, good. What's up, everybody? My name is Matt Mack, if you don't know who I am. My name is Matt Mack. And my actual name is Matthew Monius. But I go by the stage name Matt Mack. I am a recording artist and music producer based out of Garden Hill First Nation, which is a fly-in remote community in the Garden Hill, in the Island Lake region. And I really want to I really appreciate these guys for having me today. As you can tell, I'm at home. I'm not gonna make this very long, but I'm at home. We're dealing with this pandemic. One of my ways of dealing with this pandemic was working on an album, and a lot of songs that you're gonna hear, not all of the songs, but a lot of the songs. A lot of songs you're going to be hearing is off of the 2020 project. And if you like the songs, not saying you have to, but you can also get my album on CD. All the physical sales go to 50% of it goes to the amazing Bear Clan Patrol and their food hamper program, which is kind of cool. But anyways, I'm gonna stop talking and do a bit of performing for you guys. Like I said, I really appreciate you guys for having me. This is gonna be like a 9-minute performance, just so y'all can keep track of my time. And yeah, I really appreciate you guys having me. Yeah. This song is called Think Too Much. Not Think Too Much, Break Me Down. And this is live too, so you may hear some weird noises, but it's okay. I'm up in my mind again, damn, I don't know. I'm looking for them better days, I'm losing hope. I'm trying to be a better me, look what I become. I'm out here living my dreams now. Ain't nobody gonna break me down. I swear they wanna see me fall, but I ain't gonna give up now. I know I gotta break down the walls. Just know I'm growing up in the res, it wasn't always easy. I remember feeling like life wasn't for me. Searching for my dream, trying to find my way out. Searching for some answers just to find some clarity. Now I'm looking back at them days. I've come a long, long way. I made a few mistakes, but I know that I won't make it one day. Finding myself and all this pain. I couldn't do this by myself. I got my mom to thank. All the things you're going through, mom, it'll get better. Don't grow up, I'll promise to send you letters. I know this ain't easy to hear, but I'm up in my mind again. Damn, I don't know. Looking for the better days, I'm losing hope. I'm trying to be a better me, look what I've become. I'm out here living my dreams now. Ain't nobody gonna break me down. I swear they wanna see me fall, but I ain't gonna give up now. I know I gotta break down the walls. Just know I'll be fine. Yeah. Again, this song is off the 2020 project. The music video for the song's dropping this Friday, so keep an eye and look out. I'm up in my mind again, damn, I don't know. I'm looking for them better days, I'm losing hope. I'm trying to be a better me, look what I become. I'm out here living my dreams now. Ain't nobody gonna break me down. That's where they wanna see me fall, but I ain't gonna give up now. I know I gotta break down the walls, just know I'll be fine. Yo, I really appreciate this opportunity. This song was off of the 2020 project. 20% of, 50% of the physical copies go to Bear Clan Patrol and their amazing food hamper program. This is another song off the project. It's called Think Too Much.
Come on, man.
I think too much, like I'ma lose my head. So many die too young. Sometimes I feel I'm next. Too many others, we started struggling. This life is yours, you can get it how you want it, yeah. So let me feel these lungs. Let me use this stress to come. As I sit here in the silence, I'm having trouble just to hear myself. Not really caring what the time is. Am I crazy, man? I just can't tell. I've lost my fire. Back and forth from heaven and hell. I've lost my desire. Give me space cause I need to yell. As I'm sitting here alone, alone, yeah. I'm just a body with a lonely soul and nowhere else to go. Much like I'ma lose my head. So many die too young. Sometimes I feel I'm next. To all my youngers, we steady struggling. This life is yours, you can get it how you want it, yeah. So let me feel these lungs. Let me use this stress to overcome. So many times I wonder, is this a lie? Will it come to an end? I just don't understand why. I get too close, I don't know why I try. Paranoia got me feeling like, yeah, overthinking. And my thoughts I'm sinking, and emotionally breaking, mentally broken, yeah. As I'm sitting here alone, alone, yeah. I'm just a body with a lonely soul, no. I think too much, like I'ma lose my head. So many die too young. Sometimes I feel I'm next. To all my others, we stay struggling. This life is yours, you can get it how you want it, yes. Let me feel these loves. Let me use these stress, yeah. Yeah, let me use this stress to overcome. Let me use this stress to overcome. Yeah, like I'm a yeah, yeah. So many times too young. Sometimes I feel loneliness. All right, so this song was released back in the summer. I want to perform the song for y'all. This one's called Play the Hero featuring Jay. Hey. Haters wanna hate like there's no tomorrow. Let me set a game with a little heart, yo. Try to play the hero like my name is Zorro. Name is Zorro, now everybody get up, yeah. Get on right. We can spark that flame, let my art explain. We fed up, yeah, we fed on right. We been cooking that heat, it's that underground niche, yeah. On that 2020 vision, yeah. Tryna get that plenty riches, yeah. I've done what many didn't, yeah. Let me show them people how I'm gonna get. I've been putting in this work, never thinking twice. Cooking out that dirt, now that Nietzsche on the mic. Collecting what I earned, I've been eating real nice. You been looking like a jerk if you didn't treat me right, yeah. Cause I've been keeping on that low, stacking on that box full of gold. In case anybody didn't know, my beat's so hard it's gonna shake us. So let's go. Haters wanna hate like there's no tomorrow. Let me set a game with a little heart, yo. Try to play the hero like my name is Zorro. Name is Zorro, now everybody get up, yeah. Get on right, we came to spark that flame. I'm an artist, but we fed up, yeah. We fed alright, we've been cooking that heat. It's that underground niche, yeah. All right, I really want to thank you guys for having me today. It's been an honor and a blessing, and it's been absolutely amazing. My next song that I'm going to perform for you guys, my last song for today, this song's called Paradise. This song reached #1 on the Indigenous Music Countdown. If you want to follow my Instagram, MattMac Online, Twitter at Mathimonius, and Facebook at Mathimonius. This is also off of the 2020 project. If you get the physical copy, 20% of it and 50% of it goes to Bear Clan Patrol and their amazing food hamper. Paradise, paradise, I swear my eyes are paralyzed, paralyzed, cause with you I'm in paradise, paradise, and trust me that it's redefined, redefined. You used to live without a can of life, and now I am in paradise, paradise. I'll hold you down, I swear I'll try, I just wanna share a night with you. Remember you my soul, the balance that I need. You cherish me in ways to help me to believe that you're my only hope. A place where I feel safe, a heart made of gold that I will never change. You're beautiful, I know that I will never waste this. Want you to know that I'm so happy that we waited. Want you to know that everybody out here chasing. You're on my world, so here's my whole heart for your taking. So every day when I wake up, I can't believe my eyes. I feel alive, the deepest of my dreams alive. I will take your lead, I just wanna take some time, just take my time. When I'm with you, I'm in paradise, paradise. I swear my eyes are paralyzed, paralyzed. Cause with you, I'm in paradise, paradise. And trust me that it's redefined, redefined. Used to live without a care of life, and now I am in paradise, paradise. I'll hold you down, I swear I'll try, I just wanna share a night with you. Yeah, hard to find, yeah. Yeah. All right, everybody, I really appreciate you for having me. Again, a lot of these songs are from my 2020 project that was released back in November, and if you get the CD, 50% of it goes to Bear Clan Patrol and their amazing food hamper program that feeds a lot of Indigenous families and families out in the city. So again, I really appreciate you guys for having me. Yeah, thank you so much.
Live from Garden Hill First Nation of Manitoba, that was OG music producer and recording artist Matt Mac, MATTMAC. And you know, in addition to just being blown away by Matthew's music, it just occurred to me, you could find no better example of innovative messaging. Someone get that guy to do a song about COVID-19 and fast, please. Okay, let's now welcome to our stage, so to speak, our third panelist, Dr. Eduardo Vides, whose presentation is entitled COVID-19 Pandemic, Métis Nation Public Health Messages. He's the Senior Health Policy Advisor at the MNC. Dr. Vides, welcome.
Yes, can you hear me well?
Yes, absolutely.
Thank you, Rip. Thank you very much. I would like to start saying that thank you to the Indigenous Collaborating Center for inviting me to this important panel. And I would like to acknowledge that I am presenting from Ottawa, the traditional territory of the Algonquin people and the Métis Nation of Ontario. Thank you, Elder Paul, for his words, and also Matt Mac for that wonderful performance. I will start in my presentation. Next slide, please. The Métis Nation COVID-19 responses and messages has been focusing on the following categories. I will try to talk here in my presentation about a few categories. However, we have more, but given that we don't have enough time, we are not able to talk about other, but this is the main categories that we consider important around public health and messages. We're going to talk about the governance, the data collection and surveillance, communications, including public health measures, and COVID-19 vaccine confidence and hesitance. Next slide, please. The Métis National Council is governed by 5 members. These governing members are the Métis Nation British Columbia, Métis Nation of Alberta, Métis Nation Saskatchewan, Manitoba Métis Federation, and the Métis Nation of Ontario. MNC governing members, through their registries and democratically elected governance structures at the local, regional, and provincial levels, are mandated and authorized to represent the citizens who comprise the Métis Nation. The work done during the COVID-19 pandemic by the Métis Nation is to be applauded for a large number of actions taken by the Métis communities, Métis citizens, and leadership. This work has been supported through federal government agencies, particularly Indigenous Service Canada. Métis governing members and the Métis communities, through their own decision-making processes, have activated their plans for dealing with the virus, and limiting non-essential services was instrumental in early containment of the spread of the virus. A problem Métis Nation have faced for years is that provinces have inconsistent interpretations of federal and provincial roles in the provision of healthcare to Métis populations, and the pandemic has underscored this problem. Data governance and sovereignty should be fundamental in the engagement process of the Métis people for conducting seroprevalence and immunity research studies. Next one, I think we have next one. Okay. The second category about data collection and surveillance. We consider that surveillance activities are critical to informing public health responses to a pandemic. To make informed decisions, decision makers and leaders through the system need reliable public health data. Right now, we have a lot of gaps. And also, to respond to these data gaps of COVID-19 cases affecting Métis people, the federal government should continue actively supporting Métis organizations in their efforts to collaborate with provinces, territories, and federal partners in advancing Métis Nation-led data collection and analysis initiatives, which are essential to enhance an effective response to the COVID-19 pandemic. Next slide, please. We, speaking specifically about communications, the establishment of regular Métis Nations communication and collaboration with governmental agencies and partners and other departments in different agencies has been an essential component of the COVID-19 response. This strengths-based approach to collaboration and partnership will be highly beneficial for the planning and response for the Métis Nation. The Métis Nation has created a permanent communication channel between Métis leadership and communities, including daily updates. We will see there the Métis leader, David Chartrand, president of Manitoba Métis Federation, speaking to the nation. This is something that has been very positive. The leaders have been speaking directly to the nation, answering questions and providing updates in terms of numbers, in terms of vaccines, in terms of also very positive messages in terms of hope. This is one of a powerful powerful and success in communication using by Manitoba Métis Federation, that they have a program that is called HOPE, that the word itself, that the meaning is a feeling of expectation and desire of certain things to happen, but at the same time means helping our people exit from COVID. Now, exit COVID, that being something very powerful word, and also created a lot of hope itself to the people. And also we'll see that we have been using a lot of mechanisms to provide updates, and with the social media, newsletters, and radio programs, TV commercials, many ways to communicate with Métis citizens. The COVID-19 update meetings also occur on a regular basis between the federal government and the Métis Nation through our health committee. We have the chance to have a conversation with officials and to pose questions and answers directly for them. Next slide, please. The Métis Nation COVID-19 messages ensure that public health information and communication should be accessible through culturally appropriated quality communication campaigns. The communication component is especially important when reaching out to the Métis people about COVID-19. Specific steps have been taken to ensure that Métis population have access to information about practices for preventing and managing COVID-19 in their communities, including household practices. A direct connection needs was developed with the health services and those responsible for managing the public health information generated during the COVID-19 pandemic. Translation into niche languages, all the materials, communication materials, and niche is particularly important. Other aspects also of communication with the Métis communities are also very important in the context of COVID-19. Messages must be culturally appropriated, bearing in mind the customs, traditions, and lifestyles of the Métis population. Whenever possible, symbols and images, including such as infinity flags, prairies, the buffalo, cart, historic icons, were also used to make the message more understandable and assimilated by the communities. Such images should be suited to the cultural context, and technical and inappropriate language was avoided. We try to use very simple and direct and plain language. Relation between the health authorities and the Métis leaders need to be strengthened, taking into account their different worldviews and their understanding of health and disease, among other things, to jointly develop effective prevention and protection measures for families and communities in the face of the pandemic. The levels of communications between authorities and the Métis leaders in the provinces is completely different. We have a lot of governing members with a strong relationship with the provincial governments, and others really don't have any kind of relationship. The information should also be culturally aligned with the different worlds of view of the Métis people. Although a message may have the same prevention objective for the entire population, it will differ in the form. And also we have differences between Métis in their respective provinces. These forms should be validated by the Métis themselves. The images used in documents or social media should be inclusive and never stigmatize or stereotype Métis or other indigenous people. It's important for the information to be accessible to the community, Thus, it is necessary to know about how people receive the information. People prefer to receive or communicate orally, or whether radio spots or other communications media, including TV, are used to ensure that messages effectively reach the population. Access to internet services and electronic devices and virtual tools by Métis rural communities is a big gap. It is an issue that it should be evaluated. Next slide, please. Métis people got creative to stay connected virtually and deliver positive messages, empowering communities and celebrating Métis culture and history. One of the ways that the Métis Nation has been working on the pandemic has been to providing positive messages through the culture, to take advantage of the people are at home, to learn more about the Métis culture and the Métis history. We will see here that something that happens in person before, but now is provided by radio programs, that for the children, somebody is reading a history, stories about the culture of the Métis, or about the history of the biography of the leader Riel. And also it's important other kind of time for the culture. We have this specific program, the Vides goes on. They have every week, they have opportunity to present Métis artists, Métis musicians, singers, and also talk about a little bit about the history of the specific songs. Next slide, please. Speaking about the vaccine, the COVID-19 vaccines, confident messages is something that now it's in the process of planning and discussions, given that it's something new for everybody in Canada. However, the three national organizations, including the Métis National Council, has been supported by the federal government to create specific campaigns and support the process to inform the communities about the COVID-19 vaccine. We consider that that the positive vaccine messaging must be Métis-led and come from Métis trusted sources, for example, leadership, elders, and Métis or Indigenous health professionals. Some community members may feel the most trust from hearing messaging that comes directly from their own community. Information provided must be transparent and individual autonomy respected. There is a need for more communication on the vaccine. We are trying to learn more about all these different types of vaccines, different providers, pharmaceutical companies, how the vaccine works, and if it's safety in the short term and long term. We have a lot of questions and gaps in information about immunity. Available data or data collected needs to be shared in a meaningful way with the communities. It's another issue. We need to know how will be collected this information and how this information will be used. Indigenous communities and leadership have expressed also the desire to connect with the communities, have a chance to learn from each other about what they are doing around COVID-19 vaccine across Canada. The Métis populations across the Métis homeland are diverse. There needs to be various approaches to messaging that align with specific population needs. A multi-platform approach is needed to reach all age cohorts, social media, community radio, newsletters, one-on-one, also to have a collaboration with other information tools from other partners that also provide information to the Métis indirectly, and also identify champions. It is suggestions. People are more inclined to receive information through short videos and infographics. It is could be particularly helpful. More communication is important and required surrounding vaccine rollout and allocation. It's important to understand there is a need to understand how allocation is determined for indigenous population and why there are variances in this issue between Métis provinces and territories. Activities include social media posts of the leadership and elders being vaccinated and organizing question periods, translating some resources into Métis language, and creating innovative resources that really focusing on or to reach target population like a youth, Métis youth. From the government has organized the COVID-19 vaccine planning working group. The Métis Nation, the Métis National Council and the Métis governing members have been participating in those discussions. For example, the Métis Nation of Saskatchewan is working with the Saskatchewan province to co-develop messaging with the Métis population as the focus audience. And also MNC and other governing members and other communities are starting to post messaging from leadership on social media. These include videos and images of leaders and elders receiving the vaccine and demonstrating vaccine confidence. That would be something that is very powerful when the Métis citizens see the leaders and see the elders with that kind of confidence receiving the vaccine. The Métis Nation of Alberta also have host community health rights, health nights with a focus of vaccine. Those nights, those gatherings, they have taken advantage of those gatherings to provide an opportunity for the community members to ask specific questions about the vaccine and build vaccine confidence. Finally, I would like again to say thank you for the Collaborating Center for Indigenous Health for inviting me and for the opportunity to participate in this panel with this knowledgeable panelist. And I welcome any questions you may have. Thank you very much.
Thank you, Dr. Vides. We will now move on to our fourth and final panel for today. The panel is entitled National Highlights of Lessons Learned from Innovative COVID-19 Campaigns for Knowledge Sharing, Demystifying Information, and Addressing Stigma. Our presenter for this panel is Jocelyn Formsma, a member of the Moose Cree First Nation in Northern Ontario. She's also the Executive Director of the National Association of Friendship Centers, or NAFC. Welcome, Jocelyn.
Thank you so much, Rick. It's great to work with someone that your voice is iconic in our communities, like radio, television, like Rick Harv's voice. Man, it's iconic for me. So it's so good to be introduced by you. Wache Miswe, Shwebenish, Nishnakostun. As mentioned, I'm from Moose Cree First Nation, grew up in Northern Ontario, currently live in Ottawa, which was originally and still is unceded and unsurrendered Algonquin territory. Welcome everybody, and it's my pleasure today to talk about the COVID-19 campaign, which we call Take Care in COVID, that the NAFC launched early in the pandemic, and we're looking at doing a follow-up campaign on vaccine. So actually, I was at an AFN event in mid-March. I think March 11th or something like that was the day I was coming home, and it also happened to be the day that the pandemic was pronounced by the World Health Organization. It might have been the 12th, 11th or 12th, but it was definitely on that day I was traveling, and it was my last flight since I haven't been on an airplane since. And so that weekend, started thinking through like, oh my God, this pandemic and what's happening to our people. So for those who don't know, I work with the National Association of Friendship Centers, which we have a network of over 100 local and provincial territorial associations, local friendship centers and provincial territorial associations, from coast to coast to coast. We're in every region in Canada. And we provide a lot of frontline services, from prenatal all the way to lifelong care, seniors, elders, everything in between, education, health, justice supports. For those who know friendship centers know that there's no one way for a friendship center to be. It really relies on the communities that our friendship centers are a part of. But ultimately, our hubs for community connection. We are volunteer-run, volunteer-based organizations, civil society organizations that provide a lot of supports to Indigenous peoples that are living in urban settings. And when I say urban, I just mean anybody. I mean, we talk about communities that are over 1,000. So some of the smaller rural communities were in the north, in the territories. We just mean any community member who is not on reserve, who is living outside of Métis homelands, and who is not in Inuit Nunangat. So I want to show you a little bit of what we did. So first of all, I do not have a public health background. I'm a lawyer. I've worked in community organizations, for First Nations organizations, for First Nations governments. I have no public health background. And so when this was coming forward, we immediately reached out to our network and said, you know, whatever is happening, we're here for you as a national body. We're here to support you. We'll get through this together. And then I got a call from Dr. Janet Smiley, who works at the Well Living House in Toronto. And she said, you know, I think there's some really important work that we need to do together, especially for our urban populations. And it was just like a moment where here's a doctor, a Métis doctor, who works in public health, who works frontline as a physician, but knows our community so well in Toronto and across the country. And so immediately we entered into an agreement of partnership and decided we were going to do some communications work together. So we engaged the work of Argyle, PR company, to help us with some of this capacity, because neither one of our organizations also had large communications capacity. And we were fortunate to receive some private foundation support for friendship centers and urban Indigenous people. And so we asked them, is it okay if we use some of these funds to do some specific communications? And they said, it's totally fine. So I want to show you a couple of clips, because as Regional Chief Patricia said, our people are really good at laughing through anything. So we definitely used humor. So I'll just show you this here. Make sure that the sound is working.
I think it was the Karate Kid or Joey from Friends that once said, if you control your breath, you control your life. So I'm just here controlling my breath and keeping myself COVID-19 free. The best way to confirm if you have the virus producing COVID-19 disease is with a lab test. Controlling my life. Getting dizzy.
So we did a series of these ads with, that's Anishinaabe comedian Ryan McMahon, and we did a whole series of them. And now we look back on them, and some of them are kind of funny, they're a little bit outdated. But at the time, there was a lot unknown about COVID-19, and that was what we were trying to combat. So I'll just show you one more of the ads, and I'll talk about some of the other things that we did in the campaign.
Not only am I excited that I get to jump in the lake for the first time this summer, I'm soaking in all that luxurious vitamin D, keeping away COVID-19. You can catch COVID-19 no matter how sunny or how hot the weather is. To protect yourself, make sure you clean your hands frequently and thoroughly, and avoid touching your eyes, mouth, and nose.
Just checking if you can still hear me. Zoom has said that it's waiting for a response from the program.
I hear you.
Okay, perfect. I'll keep talking while I'm waiting for the screen to figure out what it's doing. So basically, combat and provide trusted sources of information. A lot of people turn to the friendship centers early in the, as things were happening for information. And we wanted to direct folks to friendship centers as a trusted source of information. And so we were pretty wildly successful. We had about 5 million impressions from the ads. About 77,000 people were driven to our resource website. And we had about 2,100 views of the webinars that we did. So we did 4 webinars with Janet Smiley, and we did them on different things. So the original one we had Ryan hosting, and it was just basically about what do I do to keep myself safe? What is COVID? What is going on? We did a follow-up session with some community folks, and then our last one was with elders, talking specifically about how do we keep ourselves connected to culture when we can't gather in the ways that we're used to. I'll also mention we did on the resource, we did a resource list, which was a really comprehensive resource. Every week we were scouring the internet to find funding opportunities that friendship centers could access, 2 information directly from the Government of Canada, where you could go accessibility, resources on substance use, domestic violence, youth-specific supports, Mythbusters, and then a list of resources from provincial and territorial associations. We're really encouraging everybody to follow local public health authorities as much as possible because of the nuance and changes across the country. We also were able to earn media through news, television programs, print, and one of the things that we weren't able to get to, but we really wanted to do was a series of radio ads, and thanked the community frontline workers who are working in friendship centers, homeless shelters, and with child welfare, just like people who are working frontline with our people, but we felt that weren't getting the recognition as much as healthcare workers who's totally, deserved every recognition that they were getting, but just knowing that when the pandemic hit, the doors of friendship centers went wide open and our people pivoted their programs from in-person in the centers to bringing food, supplies out to community members, and we're also providing supports to get people to their medical appointments in a safer way than public transportation, getting people to pick up prescriptions and other medicines, pivoting their programming to be online. There was a friendship center that would create an elders phone tree. So for everybody who called, they got to call one other person, and it was just a way to keep connected. They would host bingos for the elders. And as things were shutting down and opening back up, friendship centers were trying to navigate that through offering childcare, whatever was allowed by local public health. And what we had learned along the way was, and I think this is like a no-brainer, that local information counts, right? Yes, there was tons of stuff coming out from federal government. It was all over news, but what people trusted was what they were getting from their peer group and from organizations that they trusted. So we drew on that as friendship centers, knowing that we are trusted voices within our within urban communities, and we use that as our mechanism. I do have to say, as somebody who's kind of been involved in a lot of trying to organize and drive resources to the ground, that the Indigenous leadership has been.
It appears we may have lost Jocelyn Formsma. I'm not sure if she'll reconnect in a moment or not. And so I'm not sure what to do 100% here, whether I should just proceed until we find a reconnection with Jocelyn. Perhaps what we could do is begin the Q&A, and then should Jocelyn reconnect with us, she can incorporate the remainder of her presentation into any responses she may have to the questions. So I'm going to ask Dr. Eduardo Vides to please be activated, to have his microphone and video connected. And we do have some questions. I have a question here from Julie, and she says, as Dr. Vides mentioned, it's important to have communication that's tailored to the target population. How do they go about determining what messages would be best for and resonate most with each unique population? And I think a lot of people, have made the critique that, the term Indigenous is a bit of a flattening concept. And one could argue that Métis can be as well. And I'm wondering how the MNC went about promoting and encouraging as much specificity as possible. How did they go about, where it was important, refine the message in a fine-grained way?
Yes, I think it's a good question, because they have many ways to try to be focused in the population, the target population. Specifically for Métis, we would say that the term Métis Nation is so powerful, because when we talk about populations across Canada, we can say Métis, but not necessarily means that it's belong to my community. That's why we need to say Métis Nation. That is a term that create unity, create accountability for the leaders, and also the culture, the powerful messages through the culture has been very positive and successful. And also, I think there are different types of messages. The leaders, obviously, they are advocating for the rights of the Métis Nation to try to see that during the pandemic, they have identified inequity, discrimination, racism. All these kind of messages are really messages from politicians, for leaders advocating for the rights of the Métis. But there are other kind of messages that are more related with the public health, protection, and information to the communities that are in a different tone, and also different ways to approach population. I think essentially is the how to be really successful is to really create that kind of sense of that people belong to those specific communities, and that the culture is in a protector factor during these difficult times. I think is one of the ideas.
Okay, thank you, Dr. Vides. Jocelyn, it looks like we have you back. So unfortunately, we had a technical glitch there. So I imagine there are still things you'd like to get to, but the question on the table, so if you could kind of meld these aspects together, we're just trying to get into the sense of how your messaging was tailored for different subpopulations, if you want to use that language. As we know, Indigenous populations, including in the city, can be quite heterogeneous, and it's important to tailor the communications to them in a way that ensures effectiveness. So if you could speak to that, as well as bringing in the rest of your presentation that was unfortunately cut off.
Yeah, maybe that was a message, just that was good enough. We've heard enough. No, I was just going to talk a little bit about the lessons learned. So I'm not sure exactly where I got cut off, but one of the important things was that how to talk about culture, we had a lot of questions. Like we did an ad about use of traditional medicines and ceremony, and with Ryan McMahon, that kind of made light of it, which we thought would be a little bit more accessible. But once we actually like had it and looked at it, we were kind of like, it looks like we're being a little too dismissive of culture and medicines, and which is not what we were going for at all. What we wanted to say is, like, we want people to engage with their ceremonies, we want people to engage with their medicines, but we want it to be in a way that is as safe as possible. So using, you know, kind of melding the Western knowledge that we had around the virus, and then kind of changing some of our aspects of culture to just be a little bit safer. So keeping the distance and not sharing, you know, spoons or items if we could do that. And then it was just, that was a lesson that I don't think we really had a full response on. But what we tried to do was with our final Facebook Live event, we had 3 elders come and talk about how can people connect to culture in a COVID environment. So that was the way that we dealt with it, was just to try to encourage people to find creative ways. So, you know, that we are sacred, our prayers are heard just as strongly if we are at home with our own medicines and our own bundles, as when we were our gathering, and looking back to times where people had to hide and people were persecuted for our ceremonies, and how important it is today to uphold and to protect our knowledge keepers and our ceremony makers. So that was the kind of way that we were able to try to address it. And I'm also kind of responding to one of the questions that were in the Q&A earlier. So yeah, that one was something we really wrestled with. There are some limits to digital, especially, you know, we were thinking about our community members who are homeless and are unsheltered, and how do they get access to good information. So what we're thinking is we are looking at doing another round of communications strategy that's more focused on vaccine rollout. And we want to ensure this time that we're providing them with tangible items that we can hand out that will help, but then also provide that information to some of the outreach workers, to something that they can take with them that's a little bit more accessible in a format that's not digital. We think a lot of the success that we had was due to the shareability of the things that we created. So it wasn't just a poster, it was these ads that people were laughing at and thought they were funny. So we thought that they would be more likely to share them, which is what happened. They're like, haha, this is really funny, check this out. They were a little bit like, how do you call them? They're a little bit over the top, right? But we kind of did that on purpose because we wanted people to kind of connect with the ridiculousness of the premise. Like, well, yeah, you can't prevent COVID from being in the sunshine, but there was some undercurrents of what the misinformation that we were hearing on that campaign. And then with the tailoring message, we were really looking to an urban audience that was Métis, Inuit, and First Nations across the country. So obviously a lot of diversity in that. So we just kind of talked to people. We probably could have done a better job at doing more specifically for urban Inuit. So again, that's a lesson learned that we are taking in to think about another campaign. And then I just a final piece, I wanted to share this last, and hopefully my Zoom doesn't crash again because I do this, but if it does, then I've kind of answered the question too. But I just wanted to share this final video clip that was from the first Facebook Live event that we did.
So I really do think about COVID-19 as a tricky relative, and probably everybody has one or two tricky relatives, and sometimes tricky relatives are always changing too. So you think you know them at 1 minute, but then a new surprise happens. the key and one of the reasons that ways that we can interfere with COVID spread is by keeping our circles relatively small. Because what happens and where COVID has really seized the opportunity, they love large social gatherings. So this is the trickster relative that might behave themselves in a group of 5 or 10, right? But yeah, you take them into a big gathering and they're just out of control.
So yeah, that was another way that we were reaching some of our tailored audiences. Is the conversations that we had was like, you know, me sitting down with Auntie Janet, not Dr. Smiley, and sharing those storytelling traditions, you know, not looking at COVID as like big scary virus, but think of it as a tricky relative, you know, somebody that we can kind of relate to in a lot of our own communities and our own families. And it's somebody that you have to deal with, but there's ways to sort of minimize the trickiness, and as she mentioned, by some of those smaller gatherings and some of the other things that we talked about. So that's it from me. Thank you so much for letting me finish up with that. And then we had a link to our resource page that has the rest of the videos and all of the resources that we've developed.
And I believe they've been shared in the chat box. So I want to say thank you again to Eduardo and Jocelyn. That is it for us today. I want to thank everyone, all the panelists, all the participants, and to the NCCIH staff who've made this session possible and soon available to everyone who may have had to leave early or watch it at another time and place. I'd like to invite Elder Clark Paul now to close our session with a closing ceremony. Elder Paul.
Yes. I hope everybody enjoyed it. I sure did. It was a session where I learned quite a bit, and I thank all the presenters for that. And hopefully I'll be able to join you at another time. But I also have another commitment after this. I have a workshop to do for my community. So without further ado, I'll do our closing prayer and thank everybody for having me with you today. Kizuk. Nina was honest, Jinam Deluisi. Kizadam Nagiscook, a bonum winning. Tawilaliak. Gilgisi a bonum winning. Ziganum Yagal Galuka Glus Wahan Giscook Tankis Wiltisnin. Edamon Nagilgisuk, a Sahawi, Chijamisk. Shall bonum winning. Kizidu Agnanin. Well, the good year. Those Kidus show you bottom way. Kikamana. Edamon Nagilgisuk. A bonum winning in it. Tankis a bonum at this one, no doubt a bonum at it. The holy day to me just then. Well, all the Ignasic Kizuk. Uncle with us and Uncle with us then. Down to Joel Maria Kiskuk. Tells you Elalio. I'm said Nogama. Thank you, everyone. I hope everybody enjoys a good, safe trip home. And thank you for having me.